This is an ABC podcast.
A couple of years ago, in a special health report feature called The Glasgow Effect, we talked about the life expectancy gap in the west of Scotland and how it wasn't due to older people losing some years of life. It was because younger people were dying tragically early, and not from heart disease or cancer, but of drug use and mental health issues. Well, data released last week by the Australian Bureau of Statistics showed that we are little different. The issue causing the greatest loss of productive years of life last year, pre-COVID, was suicide. Professor Ian Hickey is at the Brain and Mind Centre at the University of Sydney. Welcome back to the Health Report, Ian.
Thank you, Norman.
So talk us through this data.
This is the table that everyone in Australian health should read. Intentional self-harm led to 115,000 lost years of potential life last year, 115,000 in 1 year. And ischemic heart disease, which we always talk about as the biggest killer, led to 78,000. And in fact, the press release put out by the Bureau of Statistics last week drew attention to dementia, which in fact only accounted for 7,000. So of course this has got to do with we live, most of us, long lives now and may die of heart disease or cancer eventually. In fact, life expectancy for men in Australia is now 79 years and for women 85 years. But the average death for suicide is 44. And in fact, in the last decade, young people's deaths have increased.
So talk us through this 115,000 figure. How does it get to that point?
Well, you would think for every single person, what would they have lived to? And for Australian men, that would be 79. For Australian women, that would be 85. And then you look at when people die for any particular cause of death. And the average age for suicide, the median age is 44, and a very high proportion of that now is under the age of 30, particularly in the 18 to 30 age range. So you work out for each person then how many years could they have lived. If you multiply that by the total number of people that died that way, and very tragically, more than 3,300 people died by suicide last year, you can see on average, if they're up in the 30 to 40 years of life lost, then you get up to this 115,000 figure. And that's really, really different then to the causes of death when you're much older, when there's, although it may be equally tragic and there may be important issues to still be addressed in those areas, very few years of productive life are lost from most of ischemic heart disease or cancer.
And the age of suicide is falling.
It's falling. So if you track over the last 10 years, sadly I'll say, first of all, the rate of suicide in Australia pre-COVID for 2019 was still rising, as it has been over some years now. And particularly if you look after the last decade, then the rates of suicide adjusted per 100,000 have been rising in younger cohorts over the last decade. And that matches other national survey and international survey data about increased rates of anxiety and depression in young people. So something's going on in young people that has been going on for a decade, and pre-COVID was already leading to increased deaths as well as increased lives interfered with by anxiety, depression and substance misuse.
But what you're saying is we don't know exactly why.
No, everyone contends why, so social media gets blamed, all sorts of social change, whatever is going on socially, and it's not clear why. What we know is that it's changing and in the wrong direction, and that was pre-COVID. The modelling I'm associated with, which accurately predicted these actual outcomes this year, suggests that in the COVID environment with changes in education, changes in employment, changes in social dislocation, it may well get worse. So it's a real wake-up call. What are we doing now at a public health level and what we do at a health services level to try and reduce this degree of impact?
So what does this mean for our priorities?
Well, it'd be really interesting to go out in the wider world and just simply ask people, do you realise what is the most common cause of productive life lost, economically, socially? And I think people will often go back with cancer and things they're afraid of and go, no, actually mental health, suicide, drug and alcohol addiction, they're the really big issues. So I think our health priorities, our health research priorities, our public health priorities and our health service priorities, people will be really surprised because mental health accounts for about 7% only of total health spending in Australia. And that's pretty true internationally as well. So mental health and suicide prevention have never been the really big priorities they should be if you care about premature life lost, if you care about the social and economic productivity that comes from losing lives early.
And you and I have spoken about the modelling before. The government's still not using that modelling.
No. So the modelling is also not only predicting what is the future, it's choosing what would be most likely to change this. I mean, it's all very well to track these figures and produce them on a Friday afternoon. This came out last Friday afternoon. The real question is, what would make a difference? And our modelling goes to immediately in suicide prevention. There are two things in the COVID environment: economic and educational support, particularly for young people, but also following people up after attempted suicide. That has the biggest impact immediately and would save lives this year and next year. So, we've in Australia reacted really quickly, and as is demonstrated today in Victoria, effectively to the physical health threat of the virus. I'd suggest that 2021, 2022 is all going to be about the mental health effects of this economic and social change.
So suicide in young people is a priority of the Prime Minister. What was in the budget that goes to an evidence-based approach to this?
Very little. So nothing specific. The Prime Minister has received another report from the National Mental Health Commission and his suicide prevention advisor, Christine Morgan. There's the Productivity Commission report, which has been sitting with the Treasurer since the 30th of June. The government has said in fact in the Senate again today, it has that particular report and it will be released in due course. Well, I'd suggest there's some urgency about that due course. Things were not good pre-COVID. It was already actually getting worse, and now COVID has a whole additional challenge that we need to face. And much of that is being played out in young people. 45% of the job loss is in young people. It's affected women. It's affected regional and rural Australia. So we would really hope that the government does actually take effective actions, and to take your point, they're evidence-based actions that would be likely to change these numbers.
Just briefly, last week on the health report, we talked about evidence about brief interventions in the emergency department that could help in terms of connecting people, following them through and providing support. Do they work?
Yes. I'm so glad you emphasised that last week. They do work. What happens in emergency departments and follow-ups, and one of the big recommendations we've made in a collection of mental health stakeholders to the government, is that should be in the order of about $800 million nationally. It works. In the emergency department, proper protocols, just like for heart disease, just like for other problems in the emergency departments, and the effective follow-up. So those brief interventions, focus on emergency departments, proper follow-through, save lives.
Ian, thanks for joining us.
Thank you so much, Norman.
Professor Ian Hickey is Co-Director of Health and Policy at the Brain and Mind Centre at the University of Sydney. And if anything we've discussed just upsets you or you think you need support, you always can call Lifeline on 131114. You're with RN's Health Report. I'm Norman Swan. Our email address for your questions and comments is healthreport@abc.net.au. Tegan Taylor and I answer them on the podcast version of the show.